think what you'll see this evening is that the Trust has made very deliberate statements about the way it tends to go forward. It clearly articulates the commitment and the investments the Trust is going to make over the next 3 to 4 years. And this is all in the best interest of patient safety, the public at large, and more importantly, the quality of the services which the public deserve.
I think it's been a really defining year for the organisation. As many people will be aware, the NHS in general has found things quite difficult. Money's tightened up and clinical standards, quite rightly, are being increased, and our expectations of our population are also increasing. And despite that very difficult context, our staff once again have come up trumps. If you look at all the performance indicators that were measured on, and there are many, we come out really well relatively, and we've got some real significant improvement in there too. And if I'm allowed to cast forward a little bit into 15-16, some of the improvements from 14-15 we're seeing played through into this new year as well. So big thank you to the staff, because clearly without those 8,000 people working as a team, we wouldn't have been able to achieve some of the results that we got.
Well, as a trust, we need to focus on what's best for the public, the patients, the carers and the service users. But in doing that, we need to collaborate more with other organisations who are also responsible for delivering care, such as local authorities, Health Watch, clinical commissioning groups, etc. This is a partnership going forward. It's important we all commit to the same agenda, which is about improving the quality of services and the quality of care.
There's a lot of national evidence about how services are best provided, and that will lead to some change, and we're really in a really good place working with partners to be able to deliver some of that change. So we've been dialoguing with our clinical staff, we've been having some early discussion with the public about what's important to them, and I would hope that during the beginning of 16-17 we'll actually be able to go out to the public. Our clinical staff will be able to go out and say how we might improve things so that they're future-proofed and provide the very best of care across the North East.
I have visited a number of wards, departments, services since I was appointed chair, and what I've seen from staff right throughout the organisation is tremendous commitment, tremendous enthusiasm, goodwill, really wanting to engage with us. But clearly we need to show them that they are valued members of this organisation. So I welcome their input and their thoughts and perceptions of how we as an organisation are going forward.
We're a can-do organisation with can-do people. So my rallying call is please get actively involved in your specialties, listen to the population, listen to the patients, and my promise as Chief Exec and from our board is that we will enable the changes that we know will make things even better as we go forward. And we've got a really ambitious programme and a huge level of investment that we're making in the organisation and in the staff, so join in, be part of the team, and we can really go places together.